So last week we looked at how Australia's health has improved since 1900, and we looked at those five categories of disease that have seen major declines and in some cases changes over the last 100 or more years. So today we're going to move on to looking at old public health. There's a few areas in this topic that we'll move on to, but we're going to start with looking at the early changes that were made to certain things that contributed to the improvements in health that we have seen. You need to have this definition written down. So public health, this kind of term here, refers to the organisation and collective effort to improve the health of the entire population. Okay, so we're talking about looking at Australia as a whole and things that have been implemented that are widespread things that should affect and benefit everyone. Public health includes the ways that governments monitor and regulate health. So looking at things like trends in health, what kind of diseases are occurring and what people are dying from. Also how they promote health status, and we'll move more onto that in the next lesson, and preventing disease. Okay, so you'll notice that something that's kind of missing from this is treating disease, and that's kind of seen as a little bit different because it's not really focusing on the entire population. So when we treat disease, that is because certain people have certain illnesses or diseases, whereas this is more things that affect everyone. And the really big focus you'll see is on kind of preventing diseases. Once you've written these down, just pop into that Google Doc and just answer question 1. Okay, so we're looking at old public health, and these are just the pictures that I showed you last week, but just a good reminder of what life looked like 100 years ago, and that will help to kind of explain the reasons for certain strategies that were brought in. Okay, so you need to definitely put this in your notes. I think making a little table like this will help. But old public health basically were measures that were introduced in the early 1900s. Okay, and if you remember back to what we looked at last week, a huge amount of disease and death 100 years ago was caused by things like bacteria and infectious diseases. Okay, so old public health were measures that were brought in to reduce bacteria and infectious diseases. And because of that, they really focused a lot on the physical environment. So that could have been public spaces like the streets and buildings, but also on things like housing and work environments. I'm just going to go through the different measures that were brought in and then how they impacted on health. So one of the first things that came in was improving sewage systems and better sanitation. So with sanitation, we're looking at things like having garbage disposals. Okay, so in the past, people just put their rubbish on the streets, whereas this would have had people actually coming and collecting rubbish. And also improving water supplies. So making sure pipes that carry water, for example, are clean. And because of those things, there were decreases in the amount of diarrheal diseases, which can actually be really dangerous, especially for children, cholera and typhoid. So they were infectious diseases that we don't really see anymore, not in Australia, but they were very prevalent 100 years ago, but they decreased a lot after some of these measures. Another thing that was brought in was quarantine laws, which has kind of had a bit of resurgence recently with coronavirus, but this idea of keeping people isolated if they are sick, or if there's a chance that they have been infected with a disease. Okay, so that came in around 1900 after a big outbreak in bubonic plague. And with quarantine laws, that decreased the spread of diseases, which makes sense. If people are sick and you keep them away from other people, that will decrease that disease spread. There was an increase in the quality of housing, and part of that was removing slums. So removing kind of shack houses that usually would be on the outskirts of cities and be really overcrowded and really dirty. So removing those and improving housing, especially things like ventilation. So making sure that there was good airflow in houses, also water supplies, things like that. And because of that, there was a decrease in respiratory diseases. So that's really due to things like ventilation. If people are cooking, for example, inside a house that has no windows, and back then they would have been cooking on coals or on wood, lots of smoke getting into the lungs. Also in winter, people getting lots of respiratory diseases because there's no heating or no insulation in houses. And again, also removing those really overcrowded houses helped decrease the highly infectious diseases like cholera and typhoid because there's less people living in close proximity. The safety and quality of foods was increased and promoted, and that would be around having laws about making sure that food is safe to be sold, and also just educating people on food that is healthy and food that is safe. So when we talk about safe food, we're talking about things that don't have bacteria in them. And that was helped hugely after World War II, so this is kind of a bit later in the old public health, but when refrigeration became more available and people could put meat in the fridge so it didn't go off. And these changes saw decreases in stomach cancer and also in infectious disease. So a lot of bacteria is carried in food. So by having safer food and food that is stored and cooked better, decreased disease. And of course as well, by educating people on good foods, increases in nutrition. There was also improvements in working conditions, and there was a few things that went along with that. Some of them were about the physical space, so making sure that work sites were safer, so maybe they had harnesses or they were trained in how to work safely. Again, ventilation, especially in things like mines and in factories, okay, where traditionally there wasn't much ventilation and people got really sick. Having toilets, so increasing that sanitation. But then also there were laws brought in around protecting workers. So one of those things was making it illegal to employ children under the age of 13, which might sound really young, but before that, a lot of children would have been forced to work and often in really tough labour jobs. Also another thing actually that was brought in around this time was minimum wage. So employers now had to pay their workers a minimum wage. And that would have obviously had impacts on people's income and things that they're able to afford. A lot of people were still very poor, but it did bring some rights for workers. So with these better working conditions, there were decreased workplace injuries, decrease in the number of child deaths. So children were more vulnerable to, dying from injuries on work sites because they were smaller, and also decreased disease from things like having ventilation and toilets. And another really big component of old public health was bringing in antenatal care, so care during pregnancy, and then actually improving the practices of birthing. So encouraging and having facilities available for women to give birth in hospitals or with a midwife. And that had huge impacts on the rates of infant, child, and maternal mortality. Okay, so if you need to pause this here so you can finish that table, you can, and then just pop into the Google Doc and answer question 2. Here's some posters just of some early public health campaigns. I love looking at kind of old posters and just seeing, the kind of media that they used. But this was around just after or during World War I. So when the Spanish influenza was kind of starting to take off. Lovely use of rhymes there. Coughs and sneezes spread diseases. But very kind of simple messages back then. A nutrition one here, so encouraging people to start growing their own vegetables and that kind of early education around nutrition. And then see if you can figure out what this one is for. So again, this would have been kind of wartime, and this was actually an ad about syphilis, so about a sexually transmissible infection, and this would have been, before contraception was available. Condoms weren't around then, so this was really about, encouraging people to be cautious around having sex with people that may carry disease. Another really big gain in terms of public health was the discovery of vaccines. Now, vaccines themselves, actually started, the technology around them started in the late 1600s. Very kind of simple vaccines, but they became a lot more widespread and available throughout the 20th century. There are obviously a lot more vaccines than these ones, but the main ones that have had huge impacts on death rates in both Australia and worldwide are smallpox, polio, diphtheria, pertussis, which is whooping cough, you might have heard of. It's really doesn't really affect adults too much, but it can kill babies. It really affects their lungs. Tuberculosis, tetanus, polio, and measles, mumps, and rubella, which now comes in a 3-in-1 vaccine called the MMR. You don't necessarily have to remember the names of all of these vaccines, but it's probably good to have a few examples of things like smallpox, polio, tuberculosis. Oh, got polio in there twice. Are really common examples. So with this new technology, Australia started doing mass vaccinations in Australia from the 1930s. So basically vaccinating huge percentages of the population, especially children. And that's why vaccines are not considered to be a treatment, they are a preventative thing. So they fall under public health because we're giving them to everyone. Okay. This contributed to huge improvements in life expectancy, okay, especially by the time all of these vaccines were being given out. There were huge decreases in the number of people that would die from diseases, and because especially children weren't dying in those high risk years of 0 to 5 years old, that meant improvements in life expectancy. And these kind of things were being rolled out all over the world, especially in kind of higher income countries. But as a result of that, smallpox was actually eliminated worldwide. It's the only disease that is considered to be completely eradicated. And that happened in around 1980. And then polio is eradicated from most countries. We don't have it in Australia anymore, and that's why we don't even need to vaccinate for polio anymore, because no one carries the disease. But in other countries, it is still a big problem. All right, here's a graph that shows when certain disease vaccinations came in, and then the impact that that's kind of had on the number of deaths. And these are the deaths due to infectious disease, okay? It's not all deaths, so just keep note of that. So just have a look through that. And then I want you to pop into the Google Doc and answer question 3. You'll probably need to pause this as you'll need to refer back to it. And just in that question that asks you to discuss the changes in the number of deaths, make sure you use specific data from this graph. All right, then there was a bit of a shift from old public health to what we call health promotion. So if you remember, old public health was really about improving physical spaces and also vaccination. There was some early education around things like nutrition and antenatal care, but things started to shift towards educating people around health and especially some more recent diseases that were coming up. Again, you need to have this definition written down. So health promotion is the process of enabling people to increase their control over and to improve their health. Okay, so it's much more focused around educating people to make healthy choices. And these are a few images that I thought went well with this. So down here in the bottom left, the 1960s was basically the rise of the TV dinner. So this was a huge thing. I don't remember it, I'm not that old. But this was a huge thing where people could buy these packaged meals and put them in the microwave and all eat them. But obviously, I'm sure you can imagine that they are full of processed things, lots of sugar, lots of salt, lots of fat. This middle one, now this might look like a joke, it is not. So I remember I talked about really high rates of smoking kind of in the 1950s and 1960s. Doctors actually used to prescribe cigarettes to people with asthma because they thought that inhaling that smoke would relax their lungs, and even to children. So children were getting, prescribed cigarettes to help cope with their asthma. And this last picture over here, I don't know if anyone's going to recognize this. So alcohol was a huge kind of lifestyle thing for a lot of Australians, and it still is. It's a big part of Australian culture, but that obviously brings with it a lot of health problems. This picture here is actually one of Australia's old Prime Ministers, Bob Hawke, and this is a picture of him sculling, I think it was 2 or 3 pints in 11 seconds, which got him into the Guinness Book of World Records. Okay, so these are all just things around what lifestyle shifted to, and I'm sure you can probably think of some diseases that went along with these things that started to need to be addressed. So the shift to health promotion basically came as a result of these new issues in health. So life expectancy was increasing and infectious disease was decreasing because of the old public health measures. But now we had a new problem. So we've got these lifestyle related diseases. And they really started to become really evident in the 1950s and 1960s. So the shift moved from, focusing on infectious disease now to trying to address behaviours that people were making or showing that were contributing to disease. And a lot of that came through campaigns, so ads, public programs to get people doing exercise, things like that. They're considered to be health promotion because they're focusing on people changing their behaviour. The main focuses of health promotion in the early days were to decrease smoking, to decrease alcohol intake, to increase physical activity, to improve nutrition, and then a little bit later on, towards the 1980s, road safety became a big focus as well. So things like wearing seat belts, wearing helmets, all of those things. Once you've written these notes down, jump into the doc and fill out questions 4 and 5. And then I've actually found a couple of old public health ads that I think are quite interesting. So come back here and I'll show you those. These are kind of just posters that would have been up around the place. So some of them are focusing on infectious disease, some around things like cancers. So how to reduce certain types of cancers. And then I've got a few little videos of older ads. I find them pretty funny. The message was obviously quite simple and the animations are pretty simple. The helmet one is definitely my favourite.
Oh, Norm, you're not watching the telly again.
No, this is educational, Libby. It's all about obesity and how bad it is for you. I'll tell you what, I wouldn't like to catch it.
You don't catch obesity, Norm.
Huh? How do you get it then?
By eating too much, by eating the wrong things, or by not doing any exercise.
Oh. What is obesity exactly?
It's getting fat, Norm.
Oh.
When you eat more than you need, the excess energies turn into fat. To avoid obesity, cut down the amount you eat. Choose a balanced diet and include some regular exercise as part of your lifestyle. Obesity reduces your chance of a long and healthy life. So, watch what you eat and exercise regularly.
I've just got big stomach bones.
Keep your head together, wear a helmet.
This is like the stuff that gets into your lungs when you smoke. And you know what it looks like, don't you? Yeah. And what it looks like just about sums up what smoking is. If you're thinking of smoking, you've got this for brains.
So a lot of ads used to really focus on kind of shock factor, and I guess they still do. Maybe the quality has just improved a little bit. Right, the final thing I want you to do, and you'll need to upload this into your the Google Doc, is create a bit of a timeline of some of the key developments we've talked about in old public health, vaccines, and in health promotion. Now, there's not always exact years included in this. If you go through the textbook, sometimes they give exact years for certain things that came in, but just really to put things in the right order. Okay, so include things like the mass vaccinations. If you want to include specific, we do have specific years for when certain diseases started being vaccinated for. Early on, you could put, kind of group these together, things like the quarantine and improved sanitation and housing. Nutrition. Then I want you to add in when things like the health promotion campaign started coming in. When did working conditions improve? The birthing practices and antenatal care, road safety, and refrigeration of food. So just to help you kind of piece together the order that these kind of things came in. I understand that was probably a fairly short session. So if you want to go through the other questions in the textbook to consolidate that, you're more than welcome to, and send them through to me. Otherwise, we'll be moving on Friday to looking at the kind of newer take on public health. All right, take care. I'll chat to you soon.